So
Excited.
you're a senior in high school?
Yes, I am.
Okay. And then this is your project and you're interested in medicine.
I've
Good.
done a chiropractor and why can't I think of and a urologist so far.
Okay. Who's the fourth?
I have no clue yet. It's more of just like figuring out who would be able to do it. So
Right, right. Well, everybody's busy
yeah, I know.
but I like your dad, so I owe him one.
Aw, thanks. I'm glad my dad's likable. Just
He's
enough.
a good guy. Yeah, he's a good guy. So fire away. Let's
So
get
my
it done.
first question is, where did you attend college and what is your degree in?
Okay, I went to undergraduate at Denison University, which is in Ohio, Granville, Ohio. And then medical school, I went to Ohio University, which is in Athens, Ohio. And so my undergraduate degree was in science. It was a bachelor's of science. And then my medical degree, I actually became a osteopath. So there's a MD and DO. So medical doctor and osteopath are the two types of licensed physicians that can practice surgery and medicine in the US. And so I chose to become an osteopath for a lot of reasons. Basically, I like the approach better. I had a couple of buddies that I played football with in college that actually went to osteopathic school. Are you familiar with that at all? Osteopathic, allopathic?
Mm-mm.
Okay, so just a quick, you know, tutorial. Osteopathic is just a different type of philosophy. It's more holistic. It's more natural. And then there's allopathic, which is your routine, like what you would hear as doctor. So allopathic is MD, osteopathic is DO, doctor of osteopathy. So I just chose to go that way. I went to Ohio University, graduated from there with a DO, doctor in osteopathy. And then from there, you have to kind of decide what you're going to do. And so when you do clinical rotations, when you're in third and fourth medical school years, you kind of decide, hey, I like this, or I like that, or I don't like this. And then you kind of pick and choose. And then you have to do what's called an internship, which is the first year after medical school where you get broad training. You rotate through obstetrics, gynecology, emergency room, internal medicine, critical care, orthopedic, surgery. So you get a taste of everything. And then from then, you decide which residency you want to do. So you can become a family practice doctor, or you can become an ER doctor, or you could become a spine surgeon, or you can become like an orthopedist, which is what I wanted to do. And I think the reason I chose that was mostly because it was process of elimination. And I like working with my hands. I like surgery. You kind of gravitate towards whatever it is that your personality is like. And so orthopedics, I like sports medicine. I like active people. I like the surgeries. It's very mechanical. So that was kind of who I am. And so it was just a good fit for me. So once you choose a specialty, then you do a residency. And residencies, depending on what you choose to do, can be 2 years, 3 years, 5 years. So mine, orthopedic surgery, is 5 years. So it takes a long time. And I did my orthopedic residency in Philadelphia, and I spent 5 years there and trained. And then on top of that, you can decide if you want to subspecialize. So I decided that I wanted to subspecialize in arthroscopy, sports medicine. So I did an extra year on top of residency, which is called a fellowship. And then you just, that's all you do is arthroscopy and sports medicine, and you kind of focus on that and become subspecialized so that you're like an expert in it. And then for some reason, I decided I wanted to do a fellowship in shoulder reconstruction. So I went and did another fellowship in shoulder reconstruction. So I did both of those in Columbus, Georgia, at a place called the Houston Clinic. Then I finished that and I was like, well, what do I want to do? So after going to school forever and learning, which is awesome because it's just so, you're like a sponge. It's just so exciting, like just learning all that stuff. but it's tiring, and it beats you up, and you take a brutal beating on your social life and your personal life and all of those other things. Now things are getting a little bit better because they realize you need to have a balance in your life. I mean, when I was working as a resident, I was working 80, 100 hours a week, and now it's much better. It's more palatable. They try and take into account that, you know, people need to have lives and don't need to burn out. And, you know, back then it was a school of hard knocks. You know, either suck it up or get out. And either way, I went through it. But, you know, looking back, it was brutal, but it was exciting and it was awesome. And I love to learn, and I love to continually like be challenged. And so this job is not boring at all, and it's always a challenge, and it's exciting. Um, so I did the fellowships, and then I decided I wanted to teach. So I took a job at the University of Florida in Jacksonville, Florida, and I came on as chief of the sports medicine division, chief of shoulder surgery, and I did that for 8 years and taught residents, and it was great. It was exciting, but it was, again, you know, time consuming and burned you out. And I was also working at the trauma center there, so I was doing a lot of late nights and that sort of thing. I enjoyed it, and then I got married and decided it's time to go to private practice, make more money, hopefully have a little different lifestyle, some time off, which was kind of a joke because you really end up not having that much time off now. I mean, it's a consuming job, but it's gratifying. So anyhow, I left and I went into a private practice group of about 35 guys in Jacksonville, and I practiced there for another 8 years, and then you know, just was busy and kind of got tired. And like I was telling your dad, I just was kind of burned out, midlife crisis, whatever you want to call it. I had two boys and I wanted to spend time with them. So I quit, and we went and took a job in Hawaii. We lived in Maui for a year, and I worked in Maui for a year. And then we loved to travel and we loved hanging out and becoming a family again. And so we went and moved to New Zealand
Oh wow.
and practiced in New Zealand for 2 years, two and a half. And then from New Zealand, well, but basically, my dad got cancer. My mom was pretty sick. We were all the way across the world. You know, it makes it difficult. So I made a decision to come back to the States. I probably would have stayed in New Zealand. I really enjoyed it, but it's very far away.
Mhm.
I liked the practice. It's medicine. They really get the work life balance over there. It's a beautiful country. Uh, it was a good experience. Maybe I was wrapped up in just the newness of everything, but it was really cool, and we were going to stay. I was actually applying for permanent residency, but you know, my mom and dad got sick, and so we decided to come home. And I took this job up in Georgia because I didn't want to go back to the rat race in Jacksonville. And I work in a very rural setting now, a town of about 40,000. Um, it's not as taxing. It's still challenging. I enjoy it. I love it. I love being up here. I love the farm. I love to enjoy my life and have that great work life balance. And so that's where I'm at in my life right now.
Well, you kind of just answered my next like two questions, so that worked out.
I know. Yeah.
So my next question for you is what is like your starting salary gonna look like in this line of work?
Well, it depends, and it varies. So there's a lot of factors. It depends on what you want to do, whether you're out to really make money, if you want to be in private practice, or do you want to teach. Typically, teaching jobs, university jobs, pay less. And that can be anywhere between 250, $300,000 a year. But that can escalate depending on how long you're within the university system. Private practice average salary starting is probably about 500,000 a year. Um, but most guys are making about 750,000. But I know guys that are making well over $1 million, and it depends on how hard you want to work, and it depends on, your situation and what you're doing. It depends also on your location. I mean, you move to a rural setting, you're going to get paid more. Everybody wants to go to a city, so the job demand is a little bit less. So the salary is going to be less. But on average, I think the last I looked, the average orthopedic surgeon across the U.S. makes about $550,000 a year. So it's one of the highest paid uh, specialties.
Can see that.
So I think cardiothoracic surgeon and maybe neurosurgery is more.
Yeah, that would make sense that there would be more.
Yeah, well, I mean, it is a back-breaking type. It takes a lot out of you. You have terrible hours. You have to do call. So, can you hear me?
Yeah, I can hear you fine.
Yeah, you paused for a minute.
Oh.
Anyhow, here's the thing on salary. I make good money, but I also pay for it, and I don't think, if you put it into perspective, we probably actually make what we should, but I'm not greedy, and I'm happy with my lifestyle. I'm happy, and that's more important to me than making money. I just wish there was a way to control. The biggest problem with a surgical practice, is you have no control of your schedule a lot of times. So I may have to go in at midnight and be there until 4 in the morning sometimes, or miss kids stuff because I have to go operate, because that's just, you're on call and that's what you have to do. So that to me, it's a very comfortable lifestyle without a doubt, but you also work hard for it. And I don't apologize for, what I make, because I earn it.
You put the work in for it.
Yeah, so that's the thing.
So you were talking about like just how time consuming it is. Like, how do you manage your time outside of work?
Well, you mean, what do I do? Or,
Just
I
like
that
how do
that
you just like
I
do
like.
life outside of work?
Oh, what do I do for fun?
Yeah, you can just like time manage it.
uh well, I like to make sure I have a balance, and so that's one thing I've realized over time is exercise. Okay, so you need to be balanced emotionally, physically, and spiritually. So I like to take time, and believe it or not, I meditate, I do yoga, and then I try and, do a lot of physical things. So I ride mountain bike, I ride dirt bikes, I work around the farm, which is, physically taxing. Um, I try and work out, but I don't really. I used to. I played football. I used to lift weights and do like the regular routine workouts, but I really enjoy the yoga and just being active. I'm on the farm. I'm hiking. I'm climbing. I'm lifting all the time. But mountain biking, typically, I do a little bit of running, not much. My knees are shot. So the mountain biking is kind of the best thing for me. I surf when we get a chance with the boys. So they surf a lot. So they get me out. I paddleboard. And that's about it.
Sounds like a lot of fun though.
Yeah, it's awesome.
So what would you find the most challenging about your job?
Uh, I think, again, life balance is probably one of them. Number two is not getting too personally involved. I want to fix everything. I want to cure everything. I want to make everybody better, and realizing that you can't, and that's sometimes difficult. Um, I love the challenge of constant new technology, constant new information, evolving concepts and philosophies and new science. That's awesome. Um, but as far as challenge, I think work-life balance is probably the biggest thing, and just not getting too wrapped up in the job personally.
Yeah. Now I'm going to ask the opposite question. What do you find the most rewarding about your job?
Uh, uh, Obviously taking care of patients for me, trying to make people better, make people happy, healthier lifestyle, making somebody more functional, putting a total knee in somebody that's, pretty much stuck in a chair or, not able to do the things they want to do. Taking an athlete that, dislocates their shoulder, being able to put them back out on the field 6 months later, those sort of things, the gratification you get from using a skill set that you've mastered, is such a gratifying experience.
Yeah, I think that's
To take all that hard work that you did and then be able to put it into action and see it work. It's pretty cool.
yeah, it seems like it. Like whenever I like hear stories about that stuff, I'm like, whoa, like that's so cool that people can like do that. Like
Yeah,
it's so
it is
interesting.
cool. It is, and it's exciting. Like when you look at what you could do and what I am doing are two different things. And I always kind of, when I get frustrated or tired or I don't know, patients are a pain in the ass, I'll just be like, yeah, but you know what? I get to do some pretty cool shit.
Yeah, you do.
Yeah. So
What would
so
you
it makes it better.
Yeah. So what would you say are like some essential basic skills? Like they could be personality traits that you would think that are necessary to like do this line of work.
I mean, you name it, you use them all. I mean, perseverance, hard work, patience, compassion. I mean, you have everything. I mean, it takes, and that's the other thing is that it's physically and emotionally exhausting, mentally exhausting, because it takes everything from you. But that's so gratifying to be able to be spent, you know, doing something that you enjoy,
Mhm.
if that makes sense. So a lot of personality traits. I mean, I can go down the list and say I've experienced them all, but in general, the skill set, personality wise, I think it's just commitment, it's passion, it's compassion, empathy. I mean, I could go on and on. Different personality characteristics you have to have, um, and then knowing when to use them and when to turn them off is another thing. And it's just it's a great thing. And you also need to have certain amount of manual skills to be a surgeon. So not everybody's a great hands-on dexterity type person. And I think you decide whether or not you're one of those people that can use your hands or whether you're not. And, that kind of plays out throughout your rotations. And do you enjoy surgery? Do you enjoy using your hands, constructing stuff and fixing stuff? And people that do, they gravitate towards surgery, and people that don't, they gravitate towards more uh, uh, medicine type practices where it's more mental and complex problem solving and those sort of things.
Mhm. And this may be a simple question, or maybe you may have multiple answers. But what would you say is like the most common surgery that like you've performed?
Most common for me would be arthroscopy, whether it's a knee arthroscopy, a shoulder arthroscopy. So arthroscopy means looking inside the joint. So you make little small incisions and you put a camera in the shoulder or knee or ankle or wherever. I mean, they're doing scopes on wrists, elbows, everything. So arthroscopy is what, because of the type of practice, because of my subspecialty, that's what I do. Um, when I'm on call, it's fracture work. It could be hip fractures or any fracture really of extremities, like a tibia or femur or humerus, those sort of things. So, but by far, just the type of practice that I do mostly arthroscopy, ACL reconstructions, rotator cuff repairs, those sort of things.
So cool. My dad, like, whenever one of his like buddies that like bikes or whatever ends up like
Mm-hmm.
some sort of like surgery, they always send him pictures so that I can look at them. So I
Yeah.
just have, like a bunch of pictures of like an ankle with screws in it or something like that. And all my friends are
Yeah.
like, "And like, what are you doing?" I'm like, "It's cool. Like, leave me alone."
Yep. Yep. It's very cool. So I'm glad you like it. I'm glad you have an interest in it. Um, the best thing that you can do is just keep doing what you're doing, pursue things, learn as much as you can, get online. Now, are you where are you going to go to school?
I'm
Are you
going.
done with your Are you
Oh,
done with your questions?
I have one more, but
Oh, okay.
I'll answer this one. I'm going to Queen's University in Charlotte for volleyball.
Okay. Good for you.
Yeah,
How
I'm
tall are you?
I'm about 5'9",
Okay. Are
so
you a set? What position?
I'm an outside hitter, so
Okay.
I play all the way around. I don't know if you know any of that, but I play all the way around so that
Yeah.
I stay on the court.
Nice. Nice. Well, good for you.
Thank
That'll
you.
be fun. And then I assume you're going to do like bachelor of science or pre-med or
Yeah, I think
nice.
pretty much everyone at Queens, like on the volleyball team, is like a science major. I think we have like one business major, so we all kind of go the science route.
Nice. So you'll be surrounded by like people.
Yeah, so I'm excited
Nice.
for that.
Good. Well, just, focus on volleyball, focus on college, just get good grades and then you can worry your junior year about med school.
Yeah, it's always
So,
the junior year.
yep, exactly.
So my last question is, what are some things you have to be careful about when you're working with a patient?
Ah, well, I mean, you can start with just the, risks involved with patient care. So, obviously, infection, especially with the pandemic and everything, it comes to light. But I remember when I was a resident in Philadelphia, HIV was the big thing. So, like, you had to be very cautious and all these precautions that we take with gloves and and bodily fluid stuff and those sort of things. So, obviously top on the list is potential infection risk. So you got corona, you got hepatitis, all these things you worry about. So you use universal precautions to try and prevent that. And then you just have your regular infections and stuff you can pick up from people and flu and that sort of thing. So, what was the question again?
What are some things you have to be careful about when working with a patient?
Yeah. So other things is kind of I think the biggest thing is reading a patient, their personality, um, trying to figure out what it is that they want, what can you do to help them, um, those sort of things. And I don't know. That's really the big. Say the question again. I'm just trying to think it through.
Like, what are some things you have to be careful about while working with a patient?
So from like a health standpoint, the surgical risks, the infection risks, those sort of things. Um, and I think you need to be careful with their personalities. Everybody's different, what they're trying to accomplish, what they want. Believe it or not, there's a lot of people that you're really not sure. Do they want to go back to work? Don't they want to go back to work? Why are they in the office? Um, and also just being careful um, not to overlook people's concerns. It's one thing that I've realized over the years that a lot of people don't want to hurt. They don't want to have anything wrong with them. But the reality of life is we age and things go wrong and things break and that's just the way it is. And so a lot of times I become callous to the fact that, hey, somebody comes in, some lady comes in and she's doing too much jazzercise and her knee hurts a little bit. But last night I took care of a guy that snapped his femur in half in a car accident. And so, like, trying to keep that stuff into perspective, I have to take a step back sometimes and be like, instead of saying, hey, life could be a lot worse, or, you know what, you're getting old, get over it. I have to say, okay, this bothers this person, taking a step back, yeah, you didn't snap your femur last night. Like, sometimes I see somebody and they're complaining about literally, like, my shoulder hurts. It's a little bit of bursitis. And it could be a lot worse. It could be
Yeah.
a lot worse. Like, for me, it's taking a step back and saying, okay, you have legitimate complaints, even though I might not think they are. But that's okay. You know, that's life. It's all your perspective. So,
Well, that
all
was
right.
the last question. So actually, I have one more, but this is more just like
Yeah,
personal. You mentioned that you played football. Now, did you play football in college?
I did.
So I have a question, just because I'm about to play a sport in college. Like, how did you time manage like your work and like practice?
You got to do what you got to do. You know what? I mean, you do the best you can. You're committed to your sport, so you do that. You're committed to your grades, you do that, and just and just don't become non-social.
Mhm.
So your social life will become studying. Your social life will become your team, and that's okay. And I think it just balance is tough. I mean, I'm a procrastinator, so I
I
used to
think
pull a
everyone
lot of all
can
night.
attest to that.
I used to pull a lot of all nighters and that sort of thing. And you know what though, you get by, and like life is good, and you're experiencing great stuff. And yeah, sometimes it sucks. You gotta go study. You can't go out. You can't do this. You can't do that. But you know what? Like I said, it's better than the alternative. You could not be at school. You could be sick. You could have cancer. You could, so keeping an attitude of perspective, I think is the key to balancing your life. Not
Yeah.
to get too philosophical,
It's okay.
but
Thank you.
yeah. All right.
Yep, those are all my questions. So thank you so much for answering them and taking the time to talk with me.
Yeah, you're
Thanks
welcome.
a lot.
All right. Well, listen, hopefully I'll see you in person someday. Maybe I'll get to watch you play.
Yeah, that'd be awesome. If you're ever in town, just let my dad know or me know, and I'd be like, hey, I have a game. Like, you guys can watch.
Yeah.
And you can watch him online. So
I just want free tickets.
I mean, they're all free. So
I know. I know. All right. Well, listen, good luck to you.
thank
Let me know if you need anything. Tell your dad I said hi, and hopefully I'll see him soon in May.
you. I will. Thank you so much again.
Take care. Bye bye.
Bye.